Okay. Good morning, Chairman. Ladies and gentlemen, it's my great pleasure to present midterm results of the short-stem thoracic arthroplasty in the patient with osteonecrosis of the femoral head. The osteonecrosis of the femoral head usually affect the young adult hip joints, so the thoracic arthroplasty would ideally preserve the bone mass in order to make the revision easier if necessary in the future. The conventional stem may have some clinical problems such as MD mismatch, thigh pains, stage sheddings, polypolitic fractures, and difficult removal when the revision is necessary. So the short stem was developed to reduce these problems. It has a metaphyseal fittings and no diaphyseal anchorings, so it may minimize these problems. The ONFH has some different characteristics, such as occur in the young patients, bilateral disease, and involve the bony ingrowth in similar implants. For the gap of knowledge, there were few studies about the short stem in patients with ONFH. The objective of this study is to evaluate the clinical and the radiographic midterm results of the short stem in ONFH. The hypothesis is the short stem would be a promising procedure for the patient with ONFH. The inclusion criteria is the patient aged over 15 years, advanced osteonecrosis, and good bone qualities. Exclusion criteria is the anatomical variants that complicate implantation of the short stem. For the femoral stem, we use the metal short stem from the B-bulbs. It is seamless, colorless, and tapered prosthesis. For the acetabulum cuff, we use the plasma fit cuff from the B-bulbs, and in this study, we use the autopilot navigations with THA-4 software cuff only. For the postoperative, any intraoperative femoral fractures were treated with the circuit wire. The patient without intraoperative fractures we allow to fully weight bearing, but in the case of fractures, we allow the two partial weight bearing. For the follow-ups, we contact every 3 months in the first years, and then every 6 months, we send the AP film of the bone hip with 15-degree internal rotations and lateral cross table. For the outcomes, we review the bone developments and the radial cell lines using the growing zones stem subsidence and record the hand hip score at the 6 months and then yearly. Now we are moving to the results. There were 85 cases in the present studies. The mean follow-up was 69.3 months. The most common size of the femoral stem in this study was size 0. The mean hand hip score significantly improved from the pre-operative. For the complications, there were 4 cases of the intraoperative femoral fractures, and these were treated with the circuit wires and no further subsidence. 1 distal stem perforations, and 1 subsidence about 5 mm with no further subsidence. The radiographic change allow the stem shows the bone tubercular developments mostly on the growing zone 6 and 7. There were 2 case revisions because of the polytic fractures at the 4 years and aseptic loosening of the acetabulum cuff at 2 years. This picture shows the radiographic of the femoral stem revisions with the conventional stem and page fixation. About the Kaplan-Meier survivorship, the Kaplan-Meier survivorship with the endpoint of the stem revision for any lesions was 98.8%, and at the endpoint of the stem revision for aseptic loosening was 100% at 7 years. Some studies describe the poor bone qualities and defects in the bone metabolism in the ONFH, so it may result in the poor osseointegrations and possibly loosening of the stem. In this study, we found that promising midterm results of the metal stem on the patient with the ONFH. The mean hand hip score was significantly improved. The bone tubercular developments mainly on the medial side of the stems, so it revealed a concentrated loss distribution on the calcareous areas. which is an important region to guarantee the long-term implant survival. There were 4 cases of the intraoperative fractures due to narrow neck diameter in the Thai patients, 1 case of distal stem perforations due to technical error during the early experience period, and 1 case subsidence due to the underside of the stems that stable at 3 months. To compare to the other studies, the first study from the Carlatoson's 19 hips using touchpad hypothesis with the mean follow-up 44 months, Wong's 9 hips using CFP short stem with the mean follow-up 18 months, and says 26 hips using Mayo stem with the midterm follow-ups. All of these studies show no revision or loosening of the stem. For the limitation in this study was not based on the dual energy radiograph absorptiometries, so we cannot objectively evaluate the change in the bone density as performed by single surgeons. In conclusion, the midterm clinical and radiographic results of the metal stem in the patient with the OMFH were promising. Its design enabled preservation of the bone stocks, and the bone tubercular appeared to confirm the assumption of the proximal force transmissions. Thank you for your attention.
Thank you.